That was a very, very generous introduction. Yeah, thank you for that. Good morning, everyone. How are you guys doing?
Good, good.
First of all, I want to all of us to congratulate Ayurveda Association of Florida and Aparna and her team of Board of Directors of AAF for arranging this wonderful conference in this amazing auditorium here. So give her a big round of applause. I know the Ayurveda Association of Florida, Aparna, Rupali Panse here, Kifi, who is there, and then Jeff Mitchell, and all of the team, they have been working very hard for last months, and this is our opportunity to be here based on all the hard work that they have put in. And I also want to appreciate the earlier panel who gave us really powerful words of wisdom. So to continue that, we have another icon of Vedic sciences here with us. Please welcome Vamdevaji, Dr. David Frawley. We met in person about 35 years ago in Seattle, very close to West University, where we had lunch together. And by that time, he already had more than 15 books published about Ayurveda, Yoga, Jyotish, and Vedic sciences. Right now, he has more than 50 books published in multiple languages of the world, and he has been a main source of spreading Vedic sciences all over US and all over the globe. So he is the founder and director of American Institute of Vedic Studies, and the government of India has honored him with the Padma Bhushan Award for the work that he has done in spreading Vedic sciences globally. And what makes his work so special is his ability to bridge ancient wisdom and modern science, specifically in a language that is easy to understand. So I have seen him explain complex topics that were locked in Sanskrit shlokas in a way that it is accessible to a person who doesn't understand a single word of Sanskrit. And that's where Dr. Frawley's style of communication is. So, Vamdevaji, once again, on behalf of Ayurveda Association of Florida and on behalf of all of our Ayurveda learning community, I welcome you. And then we are going to be today discussing about how Ayurveda can integrate into global sustainable medicine. I have a request for the technical people. Can we have one more mic for Dr. Frawley? Yeah.
Namaste, Shri Guru Pyo Namaha. It is my great honor to be before you. We had another conference a couple of years ago in Florida that was very well done. And this is also in a wonderful place, with very good prana, very good flow of ideas, insights, and people coming together at various levels for new thoughts, new views, and also for bringing the ancient teachings, the eternal teachings, for the benefit of all. I would like to especially thank Vivek, who is now one of the great organizers of Ayurveda in the United States and soon globally. has also brought together all the different sides of it and the vision of the future, because we do have to unite, integrate, spread, communicate, because the health, well-being, and lifestyle issues we have in what we call a civilizational crisis. And I think Ayurveda has a lot of the answers to that. They're not necessarily so technical, although they do have their technical side, but they are and can be accessible to everyone. And it's interesting to see, I've been working with Ayurveda for a number of decades, including yoga, and we do see this Ayurvedic community now in almost every country. We have a number of friends in Brazil, for example, who are doing a lot of work that way. And we have Vedic connections. We have a Vedic counseling and Ayurvedic group. We do via Zoom, via Russia, and we've had 300 people go through that in the last couple of years. And we have the tremendous development of Ayurveda in India, including all the new hospitals, including the greater access to Ayurveda, and the global communication between Ayurveda outside of India, Ayurveda inside of India. And I think it's very important that we have a great association in Florida, because it's kind of at the root of the United States, and it connects to people in so many levels. So I do hope and I do think that this association will grow. We've had many good speakers, we have many good speakers coming, and we can then create the motivation, the inspiration to draw other people in, because Ayurveda has the power of transformation and bringing well-being of body and mind to all.
Thank you, Ramdev. Once again, I'm always full of gratitude that every time I just pick up the phone and call him and say, we want you to be on this webinar, Zoom call, or we want you to come to Orlando. Last time I invited him, and he always has a very affirmative yes. He says, Vivek, anytime you call me, I'll be there, because I want to support the work of Ayurveda, and specifically to make sure that the authentic Ayurveda progresses in this country. So, Ramdev, we always explain that Ayurveda is the science of life. So how does this timeless wisdom translate when we are having the current conquest of sustainability? And how does Ayurveda help sustainable healthcare both for people as well as the planet? What are your thoughts?
Yes, very important. Ayurveda, of course, is very much connected to prana. Prana is the foundation. Ayur means prana, but it also means sustainable prana. Ayurveda is often said to be the medicine of nature, meaning the medicine of prana. And by prana, we just don't simply mean the breath. We mean the universal life force that is connected to the universal consciousness. And we're living in a prana developing and a prana promoting environment is key to health and well-being, and into a prana promoting lifestyle, home, and to sharing prana, not simply trying to control and to dominate. Of course, we live in a technological era, and we also have technological and pharmaceutical medicine. It has its place, but it doesn't bring us the prana that we necessarily need, and it tends to isolate us from the greater world of nature. Ayurveda is about reintegrating the universe, all the elements within us, balancing the 5 elements in our own nature, physical and mental. And it is also about giving us an inspiration of extending the life power, the life force, and motivating everyone to have that sense of well-being and sense that we do live in this universe that can bring us well-being on all sides. And Ayurveda is the system of medicine. It is not simply healing, it is reawakening that pranic power within all, which is boundless. If we can connect to it, it pervades space, the clouds, the waters, you by the ocean here. So Ayurveda brings that lasting healing, not just like simply a technical or chemical adjustment, which does have its place also.
Thank you for those words of wisdom, because we all know that Ayurveda's foundation is the Pancha Mahabhutas, the 5 gross principles of earth, water, fire, air, and ether, or Prithvi, Jala, Agni, Vayu, and Akash. And Ayurveda, Yoga maintain that you see these Pancha Mahabhutas, or 5 gross elements, both in every human being, every life form, and also in the universe that surrounds these life forms. So our planet is made up of Pancha Mahabhutas, and each of us is made up of Pancha Mahabhutas. And Ayurveda tells us how we can enhance our health, how we can prevent health problems, and how we can reverse both acute and chronic diseases with the help of these Pancha Mahabhutas. So if you talk about global sustainability, then Ayurveda actually walks us how we can use the Pancha Mahabhutas for our health, and how we can help maintain the balance of the Pancha Mahabhutas in the planet and the environment that surrounds us. So Ayurveda is the most apt science to help global sustainability. So in your view, Bamdevaji, what is the most meaningful way for Ayurveda to integrate with modern medicine? Because here we are at a university where a lot of research is happening in healthcare sciences, and one of these days we will see courses happening right here in this university, whether it is certificate courses or master courses or even MD courses in Ayurvedic medicine. So how do you see Ayurveda integrating with modern medicine?
Well, I think we need to change a little bit. It's about how we see modern medicine integrating with Ayurveda. Because Ayurveda has that greater global, natural, and universal view. It's not simply connected only to human beings and our artificial lifestyles. We do have to address those. It's not simply limited to technology. It shows us the wisdom of life on all levels, and how to bring the healing forces out of our own senses, the mind, the nervous system, the earth on which we stand, the plants around us. What is the body composed of is mainly fluids. And getting the proper movement of the water, the fluids, the rasa, to hold the prana, and to sustain the transformation and the sharing of nutrients. It's like you have to have that earth model in your own health and well-being. And the modern medicine has very great insights, very practical tools, particularly for more acute conditions. But we also have to remember that nature teaches us, our own body, our own mind teaches us, if we know how to read the forces of the elements within us and to sustain the sacred nature of all the elements. The earth is sacred, the waters are sacred. We all know about Agni as the sacred fire, whether it's the Jata Agni, whether it's the Prana Agni, all the way up to the Chidagni. And we also have the power of air, the prana, and the sacred nature of space. A lot of healing comes in space and solitude. So these two sciences need to be integrated, but we also need to have this broader view of connecting to a greater harmony for the benefit of the planet and our place in the universe.
Yes, I believe that modern medicine has to integrate with Ayurveda, and I have seen this in my own clinic. So 36 years ago in Seattle, we established our natural medicine clinic, and then we had our Ayu Academy, and I see some of my students like Jillian is here, and then a few of us are here. So we have seen Ayurveda being integrated into modern medicine, like you have a functional medicine practice there in Seattle. I have my friend Dr. Amit Guman, who is integrating Chinese and Oriental medicine under Ayurveda. I have many yoga therapists here who I have seen integrating Ayurveda with yoga. I see Dr. Shanke, who integrates Ayurveda with Siddha medicine, which is actually a sister science. And then we have quite a few practitioners of nutrition, and Dr. Durve here integrates Ayurveda into naturopathic medicine. So in our clinic, I remember under the umbrella of natural medicine, we had in our team acupuncturists, we had naturopathic doctors, we had Dr. Tanmeet Sethi, who was an MD who used to practice in our clinic, integrating modern medicine into Ayurveda. She was a gynecologist working for me. And then we have seen, of course, massage therapists and yoga therapists and registered nurses integrating that. So because Ayurveda has this broader umbrella of addressing both health promotion, disease prevention, and healing both acute and chronic diseases. It uses nutritional and diet modification, lifestyle modification, uses clinically proven herbal medicines, and also all of the physical therapy that comes under the Panchakarma. So you are able to use the Ayurvedic umbrella to integrate whether it is modern medicine, chiropractic medicine, acupuncture, massage therapy, nutritional sciences, all of that. If anyone wants to understand how you can do that in a clinical model, I have actually taught courses at Bastille University where they train naturopathic doctors and acupuncture doctors and also physical therapists and nutritionists, and we have taught courses how they can use the Ayurveda model to integrate rest of the systems in there. So Kamdevaji, as Ayurveda grows globally, how can we maintain its authenticity while also fostering credible scientific collaboration and research? How do we do that?
Yes, that's a very interesting and potentially a very complex issue. But the first thing, of course, is simply to recognize that healing has to be based on lifestyle, behavior, fundamental factors of life, exercise, food, sleep, state of awareness, and also to recognize that we are not just isolated entities. Our relationship with our family, with our society, with our community, with the nature around us has to be brought into perspective. And we have to recognize we are not a machine. We have this organic nature. We are also connected to the flowers, the leaves, the clouds, the earth. So we cannot just simply be reduced to a set of chemical formulas. We do have chemical results of what we do. We have to recognize how this flow of prana and healing is going through us, and also how we can facilitate that in others. Look at the power of the healing touch. Look at the power of the Ayurvedic healing oils. Look at the power of herbs. They have a certain power of prana. It may not be as directly powerful as certain chemicals, but it has a certain affinity with us and ability to awaken higher pranas within and around us. So we need to reintegrate healing with society, with lifestyle, and with recognition of where we are, and recognition that it is our role to bring well-being, not just for ourselves, but for all living beings and for the planet as a whole.
Thank you for sharing that. Because when we talk about maintaining authenticity of Ayurveda, specifically fostering credible scientific research and collaborating, we have one example of that here. We have Aniruddha Joshi here, who has the Nadi Tarangini, where he has done research with science and to integrate the whole Nadi Vigyan or the pulse science into a scientific tangible technology. And I remember good 39 years ago when I was doing my MD Ayurveda research thesis in Pune, I had the challenge of providing scientific evidence in a thesis form by doing a double-blind placebo-controlled crossover trial. So what we did is that we had 280 acne patients, and we first did their Vata Pitta Kapha Prakriti evaluation using the Ashtavidha Pariksha or the 8-step evaluation of Ayurveda, and then we classified within each group. There was a Vata group, Pitta group and Kapha group of patients, and within those we decided for each of them to get their dermatological classification. So in Pune at BJ Medical College, in the dermatology department, there was a professor called Gharpuri, and he had his clinic on Karve Road. So I had two of his assistants work with me, where they did the classification of the acne. So the acne is classified into white head and black head, and then papule, pustule, and then cysts. So we did a classification and we divided the whole acne area into zones. So we had the forehead as the one zone, then the left face, the right face, then the right shoulder, front shoulder, and also the back. So there are 8 zones that were classified, and then in each zone you would make a note of whether they were whiteheads or blackheads or papules or pustules or cysts. And then every week we would evaluate them. And what we did is that we used Shankha. So Shankha, we prepared that in National Chemical Laboratory. So we got a very specific variety of Shankha, which is called as the right orientation, the Dakshinaavarta Shankha. And so we got the right oriented Shankha, and we prepared the conch of it in a very scientific way at the very famous National Chemical Laboratory. We analyzed that, and then we used Shankha both internally as well as externally. So we did a control group, people who were not using Shankha and people who were using Shankha. And then we did their liver function test before, during, and after the 4 weeks of trial. So we were able to still keep the Ayurvedic principles of Prakriti and Vikriti evaluation. We were able to use the dermatological classification. We were able to get the medicine Shankha analyzed, and then also prove scientifically that using Shankha has no liver toxicity. So it was kind of a way of integrating the modern research methodology without leaving the authenticity of Ayurveda. So like you mentioned, it is possible to continue research in Ayurveda without losing the authenticity. So what steps can we take, Vamdevaji, to train the next generation of Ayurveda professionals to work confidently and to work with integrity for integrative health systems? Because I think when patients come to us, they don't come to us saying that heal me Ayurvedically. They say, well, I have this pain or I have this limitation. Can you please help me in removing that pain? And they don't care whether we are using acupuncture or whether we are using nutrition or whether we are using Ayurveda. So all of us will be walking towards integration. So how can we train the next generation into this integrative healthcare where Ayurveda is the umbrella under which everything gets integrated?
Yes, a related issue there's this issue of having to have evidence-based medicine.
Right.
And Ayurveda is often criticized for not having evidence-based medicine. And there's a couple of things here that we need to understand. Ayurveda has the best evidence-based medicine, which I say is generational-based evidence. How does the medicine affect generations? How does it affect centuries? How does it affect the society overall? A lot of the evidence-based medical testing is very transient, and modern medicine today is having a replicability crisis where they're doing the same test years later and getting different results. So that the ultimate test is creating long-term health and well-being for you, for your family, for your society generationally, and that is also in harmony with the environment around us. So when we look at Ayurveda, we don't need to say we don't have the evidence. We have a broader and longer type of evidence. And absolutely, we must concern that it's not the chemistry that is the main factor. The main factor is our lifestyle, our behavior, all the necessary things we have to do on a daily basis, communication, work, and the environment as a whole. So Ayurveda gives us a broader view, and certainly we do need the testing. We need to test at group levels, we need to test also at individual levels, and we above all need to teach the client to have the evidence in their own life behavior by adapting not only Ayurvedic products, but an Ayurvedic way of life, and understanding how Ayurveda permeates this whole sense of wellness and health, and to be willing to say, I'm standing on a tradition that has endured for centuries, that has been used all over the world, and that has been used by communities, individuals at all levels, and has a broad perspective that can integrate whatever is healing, whatever is inspiring, whatever is calming. So Ayurveda is an entire way of life, and the science is a way of insight, vidya. Vid also means to see, and bringing new insights, as you say, an umbrella, something that can integrate all the different potentials that we have. Look at how the human body works. You have the hands, the feet, the eyes, the ears. How do we keep them all together and in harmony? We have to go back to that Ayurvedic wisdom, and we need dialogue, communication, respect, and we also need to understand, I wouldn't necessarily say boundaries, but different things are good for different things. And pain is the main thing people want to avoid, but we have to remember that a lot of the pain we are experiencing is owing to forces we set in motion in the past. You stick your hand in the fire, you don't do it because you get burned immediately. But if we're aggravating the doshas over time, your pitta will get higher. It may take months or years. Your vata also is connected to the aging process. We have to bring these factors together and recognize that Ayurveda does have that umbrella in terms of time, in terms of spirituality, psychology, connection with nature, and the vision of humanity is one family and oneself in all beings.
Yes, when we're talking about training the next generation of Ayurveda practitioners, I feel that we should go back to what Charaka said. Charaka said is that any student of Ayurveda should not limit themselves to studying only Ayurveda, but should also study related health sciences. And I remember in our IU Academy in Seattle, I used to tell my students is that don't focus on only Charak, Sushruta and Vagavad, but also I used to insist that everybody buy a copy of the anatomy coloring book and the physiology coloring book, and insisting that the students can learn anatomy, physiology, biochemistry in a very authentic way and attend dissection classes at University of Washington, the gross anatomy classes. Because the more you learn related sciences, your mastery of Ayurveda gets better. So I have seen that when somebody limits themselves to study only Ayurveda, their knowledge becomes blind and there are blinders on them. Whereas when you study other related sciences, for example, you have studied nutrition, you are a nurse practitioner, you have studied functional medicine, and by studying other related sciences, your depth of Ayurveda gets more complete. When Dr. Guman, besides studying Ayurveda, when he studied allopathic medicine in Antigua, and then also studied Oriental medicine and studied naturopathy, your understanding of Ayurveda became even more comprehensive and more deeper. So we definitely need to remove those blinders and not be arrogant Ayurvedic practitioners, but we need to be more open-minded, integrative students and practitioners. And talking about evidence theology, you know that in India there are more than 75 research institutes that are associated with all of the Ayurvedic medical colleges, and there are thousands of research theses that are published, and now the Ayush department has a whole very scientifically classified, easily accessible globally through websites and through internet, all the research. But the problem is that, I always have my favorite saying is that you can wake up somebody who is actually asleep. You can actually wake up someone who is asleep. But those who pretend to sleep, you cannot wake them up, because they refuse to wake up. For example, in this country alone, at MD Research Center in Texas, under the scientist Bharat Agarwal, there are more than 20 research theses about curcumin, the extract of turmeric alone. And they have proved how curcumin or turmeric is effective against hypercholesterolemia, against cancer, against hypertension, against diabetes, against obesity, against Parkinson, against arthritis, against allergies. So there are so many, against inflammation, so there are so many acute and chronic health problems that turmeric alone can solve. But the world around us refuses to wake up and use natural medicine. I still have in San Jose, where my clinic is, many doctors who tell their patients to stop taking curcumin and say that, well, this is not doing you anything, it is irritating your gastric mucosa. And I said, hey, 1/3 or in fact 3/4 of the world's population uses turmeric in every single meal. So turmeric is used all the way from Japan, China, Mongolia, Tibet, Singapore, Malaysia, Thailand, Vietnam, Korea, of course India, Pakistan, Afghanistan, and all over Africa. Turmeric is used in breakfast, is used in lunch, and is used in dinner. It's only in Europe and only in the North America that turmeric is not used on a daily basis. And I feel ashamed that I have to actually prescribe turmeric tablets or curcumin capsules to my patients instead of them integrating it in their meals. But the evidence is there, and there are people who refuse to wake up from their slumber. And it is our job as Ayurveda students and Ayurveda practitioners to spread this evidence and get into this real integration of health sciences. So finally, to conclude, Dr. Frawley, as someone who has devoted all of your life into spreading the Vedic wisdom, what message do you have for today's students and practitioners for carrying Ayurveda into the future, specifically in an integrative way and in a sustainable way? What is your message?
Yes. Well, in the Vedic system, all the Vedic sciences were used together in an integral way. Some years ago, I remember I was with the Shankaracharya of Kanchipura, actually this was the younger one, and we were discussing that, and he made a very interesting point. He said that Ayurveda, of course, gives health and healing for the body, and he said yoga, actually, if you look at classical yoga, yoga chitta vritti nirodha, it gives healing to the mind. We have Jyotish for understanding the movement of time and karma, and we have Vastu for understanding the forces of space. And we have various sadhanas or lifestyles or practices, and they will then include asana, pranayama, mantra, pilgrimage, various rituals. Our life should be a continual healing and enlightening ritual, which is an action done with awareness. And so we need to integrate these sciences together. We also need to integrate with nature. And I would also say that it's not just a question of science, that all these higher knowledges are also forms of art. In fact, once you work with something, it becomes a certain type of art. Look at nature. You never find a scientifically perfect leaf or a snowflake or tree, but you see that movement of energy. So we approach Ayurveda also as an art. It requires awakening inspiration in the client, not just having them follow a formula or expect a result. And also have them create the motivation, as we say, the sankalpa for healing, change of lifestyle, integration with all these forces, so that it is an adventure and it is a moment by moment re-examination and connection with the life around you and within you. So you enter the adventure of Ayurveda, which is that of the plants. The plants also have the chemistry, but they also have the pranic forces. You can also bring mantras into the plants. You can bring mantras, of course, into the all the therapies that you do, including the massage. And Ayurveda has this unique system of rasayana, or rejuvenation. And that depends not upon chemistry, it depends upon awakening the subtle energies within us. So it does have that great power. And to get people motivated, I would even use the word excited, but at least able to change their lives, improve, transform through the wisdom of Ayurveda, which is inherent in each one of us. It's inherent in the cells, the flowing of the blood, the breathing process. And the more we understand how to bring this deeper connection to the universe and to nature within us, all of the universe, as the Upanishads dwells in the small space within the heart. So you need to be inspired, and you will find that there's an endless inspiration. Ayurveda is also that eternal wellness, being, and wonderful nature of existing, being alive.
Thank you once again for those profound words. What I have found is that Ayurveda really comes to life, the science of life, when we actually adapt it in our day-to-day living. So in our Ayurveda Academy, I used to always tell students is that don't think about studying Ayurveda, but think about living Ayurveda. So from the very first day, we start practicing the pranayama, or we start practicing drinking warm water, or following the dinacharya, the daily routines of Ayurveda. And then the first step in Ayurveda in nutrition is to incorporate culinary herbs, or what we call as spices, in your kitchen. So as you start living your day using the Ayurvedic dinacharya or daily routine, as you start transforming your nutrition into Ayurvedic way of eating for your Vata, Pitta, Kapha, Prakriti, for the spring, summer, fall, winter season, as you start making those seasonal changes in your diet, in your lifestyle, Ayurveda becomes a part of your life, and then it becomes very easy for you to transmit that knowledge, to transmit that experience to your patients. Because in my clinic, I find is that the profound healing happens with people not by taking Ayurvedic herbal capsules, not by doing Abhyanga, or not by going to Panchakarma, but the profound healing happens in my patients only when they adapt Ayurvedic Dinacharya, Ayurvedic Ruticharya, and then Ayurvedic nutrition science. So if they start living Ayurveda, thinking Ayurveda, eating in an Ayurvedic style, that's when the real healing happens. And that's what I think the students need to emphasize, is that instead of just reading Charak Samhita, Sushruta Samhita, or Ashtanga Hridaya, start incorporating it. So that's the one of the first chapter of Ashtanga Hridaya says, okay, is that that you start experiencing this. So the first chapter itself talks about Brahme Murte Uttishte. So it says, okay, you start your day, okay, at a certain time, you follow these morning routines, you follow this daily routine, and then you will be able to learn Ayurveda and practice Ayurveda. So let us join to thank Vangdevaji, Dr. David Frawley here for coming and sharing this profound knowledge with us, and also for telling us that the future of Ayurveda not only lies in preserving its roots, but also spreading its branches. So join me in thanking Dr. David Frawley here.